Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Dental Fuel is brought to you by Doctors Disability Specialists, a team dedicated to helping dentists and physicians with disability insurance, life insurance, and comprehensive business planning. On our first episode of Dental Fuel, we have Dr. Tanya Mennito. Dr. Tanya Mennito is a private practice dentist as well as an adjunct faculty member at the MUSC College of Dental Medicine in Charleston, South Carolina. His dental practice, Expertise Dental, focuses on using technology to comprehensively care for his patients while helping to enhance the aesthetics of their smile. He is an experienced user on digital systems made by Planmeca, Dentsply Sirona, 3Shape, and iTero, and is heavily reliant on digital design and 3D printing for treatment planning complex cases. He lectures nationally and internationally and currently has 21 published papers on the topics of digital dentistry and dental materials. Dr. Mennito, welcome to Dental
What's up?
Fuel. How you doing?
Doing great. Happy to be here. Excited for this.
Me too. I'm excited for this. Can you tell us a little bit about your background and how you came to be the Dr. Mennito?
Sure. I actually have had a kind of a weird career. I started out in private practice right out of dental school in a Medicaid practice, actually doing kind of a lot of high volume. Saw a lot of kids, which I never thought I would do. And from there, transitioned into academics and was a full-time academician for 12 years. And then transitioned out of academics back into private practice and practice now 3 days a week in a relatively high-end cosmetic practice, and am also doing some consulting for some technology companies as well. So it's a nice mix of different things to break up the week, which I love.
I love that. Can you tell us a little bit about a clinical mistake that you can remember making in your career so far, and how you handled it and how it's helped you grow?
Yeah, of course. I mean, the reality is I've been practicing for 20 years, so the number of clinical mistakes I've made is beyond my ability to recall. But I will tell you about the first set of implants that I ever placed on a patient, and it was really actually well done the day of, and I left the procedure feeling really, really good about it. But for whatever reason, two of the three implants failed. And when anytime you place, if you're replacing a single tooth, you have options, right? You can do an
Mhm.
implant. If the implant fails, you can always fall back on a bridge. Well, this is a situation where if the implants, and I really needed all three of those implants to work. If the implants didn't work, we were falling back to a partial denture, which, let's face it, is never really a great option for our patients. So, to say the least, when the first implant failed, it was really disappointing. I still held out a little bit of hope for the other two, but then the second one failed, and then it's really hard at that point because as a practitioner, you're disappointed,
Mhm.
the patient's disappointed, and the one thing that I've learned over the course of my career is that you cannot communicate enough with your patients. And luckily, we had talked about this quite a bit before the procedure, the potential for complications. And in her case, she's a little bit medically compromised, and we knew the bone in the area we were placing these implants was a little bit sketchy. It was very soft bone, even though it was in the mandible. So luckily, we had talked about this as a possibility, but nevertheless, it's still, I honestly lose sleep over situations like this. Still, 20 years into practice, when I have something that I think should have gone differently based off of my education, everything, like I said, the day of, everything we did it guided. The implants went exactly where they should have. Everything looked great on the day of surgery, and then it's up to biology at that point. And Biology wasn't on our side. So very disappointing, but I think the fact that I had communicated with the patient a lot prior to that appointment really, it didn't make it more palatable, but the patient is more understanding, knowing that that was a possibility going in.
How did you get past that not being able to sleep? I think, one of my favorite things that I've heard you say is they're just teeth. But in this instance, I feel like the situation maybe was a little bit bigger than that. And to process that and be ready to come back the next day to work and do it all over again, how do you get past that?
I think the way you get past it is the opportunity to do it again the next day, and that's maybe the best part of our profession is that we don't have time necessarily to dwell on those outcomes that don't go our way. And to be honest, this is not a strength for me. I I I expect not perfection from myself, but I expect a very high level of dentistry from myself. And when I fall short of that, it's very difficult. And so this is you've hit a bit of a sore spot here because this is definitely not a strength. And I may not be the one to ask about this, but I've been working on it a lot over the years, and I try to give myself some grace, knowing that not everything is always in my control, for one, and knowing that quite honestly, I've trained my butt off. My attention to detail is always there for every patient. So I know I'm doing my part to make sure that the outcome is going to be successful. And sometimes, dentistry's hard. And if you're a new dentist who's just starting out, I'm sorry to tell you that dentistry is hard, and you're going to have some instances where it's going to kick your butt. Quite honestly, you're not going to be happy with the result you get for any number of reasons. We work in a tough profession, and attention to detail and the details that we have to hit, the marks we have to hit are so fine that you're not going to get there every time. But as long as you are confident that you did your best and willing to make it right, if you have an outcome that doesn't work out for a patient, say you cemented a crown and it's got an open margin, you have to be okay with cutting that crown off and redoing it at no charge for the patient. I mean, that's how I sleep at night, quite honestly, is standing behind my work. And but it doesn't get I'd say it doesn't get easier as you get older, but you have less of those instances because you're able to avoid those pitfalls maybe a little bit better.
Dentistry is hard, and I think that we all fall into trouble. And you know, everyone's experiences and how they manage difficulty, I think, is very valuable. So I appreciate you sharing that. Going back to what you were saying on communication, how much have you come to value communication with your patient? You talked about how it was important, but it's also important to look at the future and potential issues that could arise.
Absolutely. I am an educator at heart, and that doesn't mean that it's just when I'm standing up in front of a room full of people, giving a PowerPoint. It's every day in the operatory with my patients as well. So that's one of the approaches of our practice is we are all about educating our patients. And so I feel like going into any procedure, however big or small, they have probably heard more than they want about what we're going to do and the risks and complications and things like that. And and I think that sometimes they don't necessarily appreciate that, but a lot of times they do. And the bigger the case, the more complications that can arise, the more you have to communicate with them beforehand and help them understand. And there's a lot of tools that we have at our disposal now. Photography is one that we use extensively in our practice, whether it's just an intraoral camera or a nice DSLR. Just picture speaks a thousand words, and if you can show patients what's going on in their mouth, I think it's much easier then to educate them and communicate with them and bring them along for the ride, help them understand what's going on in their mouth. Because otherwise they don't know. If you tell them they have a cracked tooth but they don't have any pain, maybe they trust you, maybe they don't. If you can show them that crack on a picture, it's invaluable in my opinion. So, and it helps for lots of different things, insurance purposes, right? If insurance ever comes back at you and say, well, why did you do a crown on that tooth? Well, we have a photo of the crack in that tooth. So lots of benefits for communicating with your patients. And then of course there's the litigious end of things, and there, lawsuits and things like that. And I think there's been some studies done that show that you're far less likely to get sued if you are a good communicator and communicate well with your and effectively with your patients.
I love that. And I love the emphasis that you've put on taking photos. And I know that you're very passionate about that and the team that you work with as well. What has been one of the biggest business or financial mistake that you have encountered?
So I've actually been really fortunate in my own career. First of all, I'm an associate, so maybe that's the biggest financial mistake I've made, is not buying a practice, because as an
Some would
associate,
say.
there's yes, there's less potential for kind of income, and not having that practice that you can grow, and having that asset, I guess, on your books. But as an associate, you're basically paid on production. And I've never paid attention to my production. So maybe that's it. Maybe that's my biggest financial mistake, is I don't, a lot of people will talk about setting goals. I want to produce this much per day, or this much per month or whatever. And I've never done that, honestly. And that probably makes a lot of people cringe, because I know that's kind of in vogue to set those goals and try to hit those numbers. But I've never done that. I've always just tried to, and this may sound corny, I don't know, but I always just try to focus on doing the best that I can, and not trying to speed through procedures, right? And so maybe that's it. Maybe I haven't been focused enough on my production, but just focus more on doing good dentistry. And it's for the very reason that I stated earlier, in that if things don't turn out well, it's hard for me. It's really hard for me to stomach that. So I think I found the sweet spot of, I'm okay if I make a little less money, but I sleep well at night, because I know that the dentistry that I do is my very best, and I've not cut any corners, and am doing the very best I can. So I don't know if that's the answer you were looking for, but I think that's probably the best one that I can come up with for that question.
I think that's a valid answer. As they say, if you take care of your patients and take care of your community, the money will come and will follow. And I think that taking care of your dentistry and making sure what you're putting forward is the best that you can put kind of goes along the same lines as well too.
I'm a big believer in that, and especially, honestly wish someone had shared that with me when I was a younger dentist. I think I probably would have had less sleepless nights, if I maybe focused a little bit more on you know making sure that every T was crossed and I was dotted in every procedure. But I think that's great advice for all dentists, but especially for younger dentists, because Lord knows younger dentists graduate nowadays with a lot of debt, and they have that number, and always probably in the front of their mind, that they need to hit. But I truly believe if you do good work, you'll be fine financially, and you'll sleep well at night, and you'll have a great reputation as a clinician who really cares for their patients.
On finances, as a young dentist, there's a lot of emphasis, and it's important of investing in yourself and investing in CE. How did you invest in yourself as a new dentist in taking more CE so that way you could become a better clinician?
That's a great question. And actually, I would say that I didn't do a great job of that. when I was a young dentist. I think I went to, we have a meeting in the Southeast called the Hinman, and I would go to the Hinman every year and take a few courses. But I think in the beginning, you don't necessarily realize what you don't know. You graduate from dental school and you feel pretty good because you know how to do some basic dentistry, and you go in there and you do that dentistry, and you have such a short time frame of seeing that dentistry that you think you're pretty good at it, right? Like everything comes back in 6 months, in a year, it looks pretty good. But it's when you get, 2 years, 3 years out that you really start to see, oh man, this actually isn't holding up very well. And so I think it was at that point, it was at the really the 4 or 5 year mark where I started to be like, oh shit, I really need to get better at this. And honestly, that's a big reason why I went back into academics, because I was so discouraged by some of the work that I was seeing that was coming back on recalls after 3, 4, 5 years, that I just decided that I kind of needed to go back to school, and so I went back to teach for sure, but I also went back to learn. And so I think the advice that I would, and I give young dentists this advice all the time, to take a little bit of CE your first couple years, but get some experience, and then kind of figure out what dentistry is all about. And then year, 2 through 10, really hit it hard, and it's going to take some investment. It's going to take some money and some time that you are not going to want to spend, quite frankly. But, like I am currently going through the COIS curriculum, and I wish I had taken it 10 years ago. I mean, I don't know why I didn't. It's so helpful for understanding just a lot of the patients who come in with problems. If all you have is your dental school education, you're not going to have any idea how to treat those patients or diagnose those patients. But that being said, you need a little bit of time to experience dentistry, right? And experience those types of patients before you can really appreciate a curriculum like COIS or Spear or Dawson and Pankey and all those. So I think that that's the advice that I would give, is give it a couple years of practice. Take some things like, if you want to learn how to place implants, if you want to do composites better, those types of courses are always helpful. But as far as jumping into a big, curriculum based CE program, give it a few years and then start to invest in that, because that will pay dividends your entire career. And like I said, I really wish I had taken something like that 10 years ago.
I love watching your Koi's journey, but what I'm most impressed with is how you pack one bag when you travel. I think that's super impressive.
Because I'm a guy.
Aside from Koi's, I know that you're involved in teaching some CE courses. Are there other CE courses that you maybe like to encourage listeners to participate in? Maybe something like Empress?
Yeah, so I work for who I think is I mean, one of the best dentists in the country, Amanda C. And I get to see her day in and day out, and she is the real deal. And she and Adamo Elvis, teach a course here in Charleston, a series of courses actually called Impress, and they're fantastic. They're mostly aesthetic based courses, so anterior composites. They do an injection molding course. They do a photography course, which we're doing this weekend, veneer course. So there's a bunch of courses that they give that are really focused on aesthetics, and they're two phenomenal educators, and they bring in some guest educators. I help them with a course, for instance, and Rolando Nunez, who is kind of a bonding guru, comes in and helps them with the bonding course. And there's a lot of great people involved in that course. So that is definitely one that is would be great for clinicians of any age, because we all do composites. We all want to make our anterior composites really pretty, right? So that's something that could benefit everybody. There is the Mod Institute also here in Charleston that teaches some digital courses. So if you're into digital dentistry, they have some nice courses as well. And then, I am big and starting to get into some Seattle Study Club courses as well, and they do something interesting. They do a lot of treatment planning based exercises in those courses, which I love. It's like, here's the patient, here's the problem, what would you do? And everybody kind of gets to come up with their own treatment plan, and then everybody kind of talks about it, and then you see what the actual treatment was, and you get to either agree or disagree with what the actual treatment was. So those kind of things are really nice because you can never get enough treatment planning. You can never do enough of that, because there's such complexity in the patients who walk into our practice that, that's such a valuable resource. So I'm really, really into this, getting into the Seattle Study Club as well. And then AACD, which is a process that I'm going through right now, trying to get my accreditation for the AACD. And if you're into cosmetic dentistry, there's no better group than the AACD, I think. So they have a big meeting every year. This one's going to be in Dallas this year, and there's
Coming
some
down to
phenomenal
Texas.
speakers. Yep, exactly. Come to Texas. So
Exciting.
a lot of good options out there.
We'll be sure to include in the show notes links to those different programs and courses if listeners are interested.
Awesome.
Building a team is crucial for the success of our practices. What mistakes have you made that have allowed you to learn and grow from?
Well, it's interesting. The first dentist that I worked for was actually a dental assistant right out of dental school because long story, but when I moved to Charleston, I wasn't able to take the board exam for
Mm,
South Carolina for like 6 months. So I had to be a dental assistant basically. And I worked in a practice where the dentist just was not a good manager of people. It was there are ways that you can communicate with your staff that are positive and that are obviously going to be toxic. And this was a little bit of a toxic environment. So I learned a lot in that experience. And now I'm in a practice where we have a phenomenal culture. I mean, I think that's really important to have a culture where everybody's on the same page within the practice. And I've been in quite a few practices where I've been an associate, and it varies in each practice. Really, it's quite different. But building that culture, and it's Amanda who has built that culture. It's Dr. C who's done that because she's the boss, and it's her practice, and she's really fostered that. She's done a phenomenal job of getting people who have bought into that vision, and it's all about the patient experience. Doing the best dentistry you can, making sure the patient has as positive an experience as they can, and finding the people who are willing to come along that journey with you. And if they're not, then it's okay. You may not be a fit for our practice, just because you're a great hygienist or a great assistant or a front desk. You may not be right if you don't have that same vision. So I think having the right culture in a practice is really important. And if you're the practice owner, it's up to you to define what that is. You can't just expect your team to come up with that on their own. You have to kind of set the vision for that practice and outline what it is and review it day in and day out. I mean, we talk at our morning meetings about this quite a bit. What are we trying to accomplish today? And just reminding ourselves what our purpose is every day. So I think that's a really important thing. Notice I didn't give any mistakes that I made as far as this.
yeah,
And to be honest, I think the one mistake that I have when dealing with people is it's hard for me. I hate conflict, so
me
it's
too.
hard for me to if there's something that needs to be addressed, for me to be the one to do that, right? Because I just am not a fan of conflict. So luckily, I'm not the boss, so a lot of times I don't have to make um, that hard
Hey, it's
decision
nice to
or
punt
that
our problems sometimes.
it can be for sure. Yeah.
Yeah. For dentists who are going into an office as an associate who feel passionate about practicing in a certain way, how can the associate maybe bring some of those passions to influence the culture of the office?
That can be really difficult. And it all depends on how open the owner dentist is, right? And whether they see the need for culture. I've heard it go really badly, and I've heard it go really well. So it all really falls on the owner dentist and how open they are to adopting, that whatever your vision of culture is, or and I think a lot of it comes down to the situation. If you're buying into a practice where that dentist will be retiring in 3 years or 5 years, maybe that's a different story than whether you're going to work for a dentist who's maybe my age, who still has, 10 or 15 years left to practice. But I think it has to be done gently either way. As an associate, you have to make sure that you're not coming in and, demanding things be done your way. You have to integrate yourself a certain amount into what the established culture is, and then maybe as time goes by, slowly start to drop little hints about maybe some improvements that can be done here and there. I think that's probably the safest way to do something like that, but it can be difficult for sure.
Yeah, I completely agree. And I think that finding the right practice is also really crucial. And I think that you're in a phenomenal practice. And from the outside looking in, it seems like you all work very cohesively as a team and probably brainstorm together and have a fun time, which is awesome. Lots of jealousy from the outside looking in.
It's a very good group. But there we have challenges as well.
Don't lie.
It, it's what's that?
Don't lie.
They're not. No, no, no. You're right. It's all fantastic.
That's right.
No, it's well, I will say this. So I'm the only male in the office, and
Right on.
that can be a good thing. But there are some challenges, maybe for me or for the others. Working with a male can sometimes be different or difficult or whatever. So it's for me. It's about, once again, not. I came in. I tried to integrate myself into the culture as much as possible, and I love it. So I'm not. I don't feel like there's anything that I have to change. And I really truly do love the team that I work with. I think we have the best team in dentistry. And I say that on my Instagram all the time. And I'm not just, that's not just lip service. They truly are fantastic. And you're right. I think working with other dentists and being able to collaborate is a huge asset. Huge asset. Working solo, because I've done that before too, it's a lonely job. And when you have a tough patient who walks in the door, if you have another dentist in the office that you can collaborate and talk to about that case, it's invaluable. So having two really smart dentists that I work with is a huge asset. I love it.
Practicing dentistry can be isolating. I think surrounding yourself with a community is important, whether it's in your daily practice or outside of that. I think it's really, really important for the sake of yourself in practicing dentistry.
Agree, absolutely.
If you could provide advice to a dentist, what's the best piece of advice that you'd like to offer?
So many, so many. I'm 20 years into my career, and I think slow down and do it right would be my number one. And then 1A would be get out there and continue to learn. There's so much to learn in dentistry. And, I will say that John Coyce said something at our very first course that really rang true with me. And he said, you guys spend a lot of money to be here. The courses at Coyce and Spear and all those are expensive courses. But he said, how much would you spend to be a more confident dentist, to walk in your practice every day and feel really confident that you have the tools and the skill set to treat everybody who walks through that door? And I mean, you can't put a price tag on that. So that would be it. Slow down, do dentistry the way it's meant to be done. I think isolation is the one thing that a lot of times we maybe try to cut corners on for the sake of time or whatever, but do it right, and then get out there and continue to learn throughout your career, because not only does it give you a lot of personal satisfaction, but it gives you a lot of confidence, and walking into the office every morning feels a lot better when you're confident.
In your journey so far, have you made any regrets?
So many. Yeah, I mean, and once again, you and I were talking before we started recording about mistakes and regrets, and I've made a ton of mistakes, and I have a lot of regrets, but you learn from those, and you move on. The important thing is that you learn from them. But I tuck those way in the back of my brain, way back here, and shut the door and try to forget about them, because there's no sense in reliving those, and bringing them up over and over and over. So I'm sitting here trying to think of a true
I'm sorry.
regret that I have. And I can't come up with one. I can't come up with one, simply because, like I said, I try to do my that's my focus every day, is to do my very best. And it's hard to have regrets if you truly are doing everything, to the best of your ability. Maybe if I do have a regret, it's that I didn't get more continuing education early in my career. I think I probably could have accelerated my learning curve a little bit. But I've ended up where I am, and my journey has been extremely rewarding. And so I can't even say that I have a regret as far as that goes, because going through, the CE that I'm taking now, I have experience behind me that I can really understand what I'm being taught that much better than had I done it 10 or 15 years, prior. So no regrets,
There's value in growth in a journey. I
for sure.
absolutely love all the advice that you've shared with us tonight, and I really appreciate you taking the time to speak with us and all the listeners that will be listening to this. If people would like to connect
Happy
with
to.
you, what would be the best way?
Yeah, Instagram, Smile Professor is my handle. I'm on it multiple times a day. It is my creative outlet. And yeah, just reach out on direct message on that. I'm usually pretty good about getting back to everybody.
Go follow Dr. Mennito. You won't be disappointed. Tony, thank you so much for your
Thanks, Tanya.
time.
My pleasure. Good talking to you.
Thank you for joining us in this first series of Dental Fuel. We hope that you'll continue to tune in, where industry leaders will continue to share their mistakes and some advice for our listeners. Be sure to connect with Tony Mennito on Instagram at Smile Professor and with Ignite DDS at Ignite DDS.